Thank you for not starting my time. Thank you, Mr. Chairman, and thank you to the witnesses for testifying before the subcommittee today. And I'll probably follow up a little bit on what Dr. Harshberger was talking about. Dr. Shuren, you may recall the letter that I sent you in December of last year with Chairman Guthrie and Representative Crenshaw and Obernolte, highlighting our concerns with assurance labs for the development and post-market regulation of AI-enabled medical devices. As I outlined, I believe it's important for the FDA to facilitate the development and utilization of AI in our medical system in a way that is both safe and effective for patients. In your May 8th response to me, you stated that your vision for a voluntary AI assurance lab is to provide comprehensive and representative healthcare data for product development, training, testing, and analysis, and that such labs would be run by a third party, preferably a nonprofit institution that would be responsible for the technical infrastructure design and implementation, as well as the management and controls of the Federation of Qualified Healthcare Data Repositories. Do you intend to outsource third-party regulation and post-market review to the Coalition for Health AI, CHI?
Oh, no.
Okay, because let me also note that Google and Microsoft are founding members of the CHI. The board chair of the coalition is a representative from the Mayo Clinic, which recently reported it has over 200 algorithms currently under development for deployment in health AI and as an active business model around AI validation. So can you understand how organizations like CHI advocating for involvement in reviewing additional layers of safety at FDA and ONC does not pass the smell test and shows clear signs of attempt at regulatory capture?
Yeah, so CHI is not a reviewer for us. They're a private coalition. We engage as a federal liaison purely to provide the FDA's centered expertise in that. We participate in several coalitions with the idea of having representation from broad stakeholder groups. We've told CHI, too, they need to expand their membership as well to have more representation in the medtech side. But we do this. If they produce anything in terms of deliverables that's useful, we may take it into consideration, but they don't work for us, we don't work for them.
And so given your earlier testimony, do you support innovation, Dr. Shuren?
Yes, we support innovation.
And I do too, but that's also why I oppose your center's LDT rule. A 528-page rule is, by definition, only accessible to large corporations who can hire lawyers and consultants here in the swamp. We want bottom-up innovation. We want the pathologist to invent a new test when they are frustrated with existing options, as we saw what happened with the COVID-19 testing debacle early on in the pandemic. We want innovation to emerge organically, and governments sometimes should get out of the way, which is why I'm concerned with the direction your center is taking us, which leads to what Dr. Harshberger started, and an article in the Wall Street Journal from January 12, 2023, the FDA wants to interfere in the practice of medicine, and this goes back to this case and what was put in the 2022 omnibus bill, which gives the FDA the authority to ban some of these off-label uses of otherwise approved products. This unwarranted intrusion into the physician-patient relationship, and let me say I'm a doctor, so I'm very sensitive to the patient-physician relationship, threatens to undermine medical innovation and patient care. This is a problem for many reasons. The statute gives the FDA the power, without any public input, to prevent patients' access to off-label therapies, even though their physicians and patients have found the treatments to be beneficial or even essential, and we certainly saw this in the pandemic. We also saw that the FDA, which has touted, and your department specifically, touted using real-world data and real-world evidence. We, as members of the Doctors Caucus, pleaded with the FDA to look at real-world evidence, real-world data when it came to vaccines, the timing of COVID-19 vaccines, and the uses of vaccines in children. So it's of no surprise to us then that the FDA is refusing to use, as Ms. Harshberger said, real-world data, real-world evidence when it comes to a device, and you referred to the device in a derogatory fashion. So to me, it seems like the FDA and your department specifically doesn't want to use innovation when no other treatments work, and the treatment, the risk profile for things that potentially could work is much worse and much greater. So I think we recognize that challenge, and I would like the FDA to come up with its promise and look at real-world evidence, real-world data, and what are benefits, what are risks, certainly as you're doing, but when nothing else is available, I think that it becomes a bias on the part of the FDA. Thank you, I yield back.
We do